I decided to do Young Black Professional because, like I said, I seen that need. And through that, about 90% of the people who I was serving were in public health. They all found me through that organization. So I did notice that, when we're working in public health, a lot of times what happens is, we're developing communities and spaces for all these other people, these populations that we're serving. We're developing their communities. We're doing all of these things for them and giving them resources, giving them guidance. But we don't have communities for ourselves, at least not as many, right? So I think that, we have our Facebook groups and then we have like a few here and there. But, I was just like, we need more. We need more spaces for public health professionals to be able to really come together, really not only come together for like a webinar or one-off training or one-off career development, but just kind of constant and continuous providing of resources and then sharing those resources. I think one of my mentors in public health, she told me when I first got started in my career, one of the things that she told me was, Desiree, you do not have to reinvent the wheel on everything. And I was just like, okay. And the thing that I was doing at first, so when I got into the Department of Health, I was working on this grant and it was called the 1305 grant from CDC. Every state had this grant and it was like focused on like chronic disease prevention. And I was managing pieces of that grant and I was literally trying to figure things out. Like I had no blueprint. We had no historical documentation. Like it was literally nothing there. And I was like trying to start things from scratch. And she was like, Desiree, don't reinvent the wheel. Every state has this funding. So they're doing some variation of this program. Call them. And I was like, I can just call them? I didn't think that it was just not in my mind that I could just call these states up and they would, give me information. I remember specifically I called Mississippi State Department of Health. They gave me so much information. They like gave me documents, processes. They gave me all of these things. And then they were like, yeah, I'll hop on another call with you if you like. And then I forgot which other department I called, but I called them and they did the same thing. And I was like, wow, like I'm not alone in this. And that feeling of not being alone, now I have all of these resources. I didn't have to create them from scratch for myself. I didn't have to do all of these things. So that really stuck with me on my journey. So whenever I got into a new position, I would always say, okay, who was in this position before? Who's doing some work that is similar? Who can I reach out to and talk to? And that has helped me. That has served me greatly throughout my career because I'm able to really get in places and hit the ground running a lot of times because I'm not trying to start from scratch. So I think that concept is one of the major reasons why I decided to create the Public Health Club because I feel like, one, we need community with other public health professionals. And not only community to just talk to each other, just kind of level up our career, but also a community to share resources within our current career. Like, we have the Facebook groups, we have LinkedIn, but they're not structured, right? So I'm a person, I like structure, I like organization. So I'm like, okay, we need this many live events. We need this many, times where people can actually come together. People need kind of like structure and points to actually come together because a lot of times, like, of course, we're grown, we're adults, we can do things on our own. But a lot of times it makes it a lot easier for people to come together when they're coming together over a shared event or a shared problem or something that is shared amongst that community. So that's how the Public Health Club was born out of that idea. And I had the idea to start it around this time last year. So I've been kind of planning it in my head around that time. And then really like this year, I was like, okay, this is going to be the year that I just do it. And so I did it and it's gotten since I literally launched it like 2 weeks ago. And since then it's gotten so many people have joined, so many people have said great things. We've had this past week, we had 3 live events. We had one that was doing a Q&A focused on public health consulting. And because I wanted to make sure that people were exposed to that they can be public health consultants, especially, we have so many people with so many amazing credentials, so many, just amazing backgrounds, but they miss out on a lot of additional funding opportunities because, they may think they're not qualified or they're scared to try. So I wanted to really take the role of public health consulting and really bring that to the public. So I did free training, taught them how to do it. And then within the club space, we did a Q&A. So I had a lot of people join that Q&A and we just really talked about it and talked about how they can get started what are some things they can do, some marketing things that they can do and stuff like that. And then we have weekly mentorship sessions. So we had that. And what was great about it is that it's community. So it was not only me answering the questions. We had other people within there, like that were in the community answering questions. We had people on senior level at like CDC and like all of these people in there. And we had like DRPH students, MPH students that were asking all of these questions. And it wasn't just me answering. And that's what I love the most about it. It wasn't just me providing the answers. And that was what I've seen for this community, for everyone to be able to give guidance, because for me, I'm a person that, like, I have my opinion, but I'm not the only opinion. Like, I want other people's opinions to come into play. But that's kind of the reason of why I launched the Public Health Club. And I also have a course called Subcontracting the Six Figures that starts March 18th. So it's for people who are interested in landing contracts, but they don't really know where to start. They don't really know how to start kicking off their consulting business, their consulting side hustle, whatever they want to do. So that's the course dedicated to teaching them how and really walking them through it.
Awesome. Well, I'll be sure to link all of those in the show notes for anyone that isn't interested in joining. And don't be surprised if you see me in that community as well.
Awesome.
I think it's really important. I feel like especially the pandemic has taught us just how important community is, and how we can create these community spaces online, and just as to your point, like just creating structure and just creating opportunities for people to connect, whether that is around public health consulting type stuff or just around like life stuff. And some people might know, like, I've also launched my community, but I think it's never a zero-sum game. I don't lose anything from you having a community. You don't lose anything from me having a community. And I think it's important that we all have our communities, because they're all different spaces that people can come and feel seen and be a part of that community. But going back to your other point that you also mentioned was around not recreating the wheel. I didn't want to lose that, because I think that is important, because many of us come into new public health roles and we're like, oh my God, I need to do all this work. But then many times there are people who have done this before us, who have the groundwork, who have the foundations, or there are people in other states, other cities that are doing similar things that we can create relationships with and learn. And as you said, people were willing to share with you. And many times we disregard that, or we don't acknowledge that that's a possibility. So I'm glad that you mentioned those two things.